Hi, good afternoon, everyone. My name is Dr. Jeanette Lopez Bell, and I am one of the epidemiologists working here at the Houston Health Department. And today we're going to talk in this series of different videos every 2 weeks. We're going to talk about congenital syphilis and prevention in prenatal care. Remember, if you have any questions, always make sure to drop them in the chat and I'll be able to answer those for you. Okay. But first, let's begin talking about what is congenital syphilis. Okay, so I don't know if you're aware, but we actually faced an outbreak of syphilis. The last year, it was actually declared in 2023. A lot of different efforts were basically put out there to work for the community. But why congenital syphilis? For those that are not aware, syphilis is a bacterial infection that is actually transmitted through sexual contact, and it can actually be transmitted to the baby or the fetus while a mother is pregnant. The reason to that is because the bacteria has a form that actually cross the placenta and then infects the baby. The thing with congenital syphilis or with syphilis while infecting a pregnancy is that if the mother is not treated, that baby could potentially die. That is what we call the stillbirths, and then we're going to see a series of events. So if you see right here, why babies, they are actually one of these patients that particularly at risk for syphilis. I already mentioned those the events related to it, but the thing is that this is a disease that it's 100% preventable, treatable, and curable. Okay, so let's talk about all that here. Now, first off, we have to know what is the differences between sexually transmitted infection versus sexually transmitted disease. So basically, the term sexually transmitted refers to an infection that is basically transmitted by a virus, or bacteria, or a fungal, or a fungus, or maybe a parasite, and basically it enters a person's body through sexual contact. And we already know what is the sexual contact. It could be oral, it could be basically genital, or maybe anal. But then when the disease is actually called a sexually transmitted disease, it's because at this point, that entity, that microorganism had potentially infected the person, and signs and symptoms are observed at this point. Okay, but let's talk a little bit of data. Okay, here basically we have a graphic to the right that is basically showing you the different trends about the annual case count of syphilis. Okay, and here this all populations. So this is including males and females. Okay, we actually see right there that the trend has been that is being increasing over the time. And then in 2022, it was basically surpassing the thresholds here in the city. So that's why in 2023, it was declared as an outbreak. And a lot of different efforts were actually included throughout the Houston Health Department to help to stop the spread. On the left side of the graph of this slide, we can see the hotspot maps. Okay, so these are very good because these help us to allocate resources, to see what are the trends of the infections, and how do we get this information. So basically, these diseases are basically notifiable. So that means that by law, the providers, the laboratories, they are mandated to notify those to the local health department, and then starting from that information, we basically take decisions over how we're going to be managing them towards the benefit of the community. Okay, so let's actually talk about a little bit about syphilis. What is syphilis? What are the different stages, and why syphilis? I don't know how many of you are aware, but this is a very old disease, and actually the name of syphilis, it's like that because imagine who was the first person who actually the disease was isolated. His name was syphilis, and we have to actually go back to the 1400s. This was actually an Italian shepherd, and then from there they started like seeing a bunch of different signs and symptoms related to the disease, and then they were able to actually determine it. Okay, but syphilis is a very tricky infection. Even that it's a bacterial infection, it's thoroughly curable and also preventable. And we're going to have stages. Okay, we have early stages of syphilis. When we see early stages stages, basically a person most of the time is going to show symptoms. We can actually divide early syphilis within primary syphilis, secondary syphilis, and early latent syphilis. In the case of the primary syphilis, this is basically characterized because the person is going to have a chancre, and this chancre, it's painless, okay? And it's going to actually occur in the area where the bacteria was in contact with the person, okay? So this is the body's response to the bacteria entering into it, okay? So if you see right there on the slides, the chancre, it's going to belong to those images from the top left and also the lower or bottom left, okay? Now, secondary syphilis, the bacteria at this point had made its way in through the bloodstream, and basically we're going to see systemic symptoms such as the body rash. Also, we're going to see condylomata, that is like a wart. It looks like a wart and is highly infectious. Also, we're going to see rashes in the palms and sole, and even alopecia. And what is alopecia? It's just no more than southern hair loss in patches, as you can see right there at the right bottom corner. Okay, so the thing about this is that it's very important to recognize these symptoms, because here, this is basically starting an evolution for the disease. And then also, if somebody is childbearing capacity, or if a mother is pregnant, it's going to become very serious towards the baby. That's why prenatal care is going to be very important. So every mother or every expectant person, they actually need prenatal care, not only for syphilis, also to monitor that pregnancy throughout the time and determine if it's healthy, and if if there are things that we need to do in terms to actually prevent the baby from becoming ill or even dying. Okay. Now, about syphilis, there is a state testing policy that all providers, all OBGYN providers, they're actually mandated to test during pregnancy. So basically that means that when a mother or an expectant person goes for prenatal care, that person, it's going to require actually testing for not only syphilis, also HIV and hepatitis B during the first prenatal visit. Then at the 28 weeks, no, actually, or actually that second trimester or third trimester, and then delivery. Okay. So why this is important? Because it's going to give us like a window to actually detect if somebody has become infected, and therefore we can treat and actually prevent the baby from becoming ill. Okay. So what happens if a mother doesn't go for prenatal care for whatever reasons? Okay, remember that if you don't have an insurance, okay, here in the state of Texas, you can actually opt for Medicaid, okay, and then you're gonna get coverage throughout your entire pregnancy and also after a year of that pregnancy. Okay, that's very important to know. But now, if a mother or an expectant person is not treated during her pregnancy, we are going to see congenital syphilis. And congenital syphilis is manifested in different ways, okay? We're going to see that the bacteria is going to start like affecting the bones of the baby, making basically those bones, specifically the long bones in the limbs, to become like bowed, okay? And then also we're going to see other manifestations as skin rashes, snuffles that are actually like mucus secretions coming from the nasal cavity from the baby. And this is also going to be important because it can also put at risk healthcare staff while working with these babies out at delivery. Okay, but as I mentioned, this is basically totally preventable and curable. The treatment is going to be by a medication that it's called benzathine penicillin G. We also call it BIC or actually benzathine penicillin. A mother, depending on the staging of syphilis, it's going to be the treatment that they're going to require. It might be 3 doses or 3 injections, or it might be only 1 dose, depending if it's early versus if it's late syphilis. And then the person needs to be adequately treated in terms to prevent congenital syphilis from happening. But now, what happened to the partners? Because we're actually talking about sexually transmitted infection. partners also, they need to be treated. That's something very important. Okay, that's why we need to actually encourage the population to stop the spread. And remember that together we fulfill the promise. Okay, having prenatal care, it's always important for you if you want you and your baby to be healthy. And then remember that if you have questions, you can drop them in the chat and I can actually later get back to you. Thank you so much for reaching out. See you the next time.